everybody, this is Dr. Hardell. Welcome to week 5. First thing I wanted to mention, if any of you are having trouble with the videos taking a long time to upload, I found that YouTube tends to work better on Google Chrome, so just something to keep in mind there. And then this week, our DQ revolves around assessment and evaluation. So many different components that we could talk about on that topic. It's just huge. A few that I want to zero in on, though. First of all, you guys all know we need to be using formative and substantive assessment and evaluation techniques. And basically, if we just use summative, like maybe a course that has a midterm, a paper, and a final, then we're not going to be able to evaluate the effectiveness of our teaching for the students as we progress through the course. We'll just have that summative data, and it's going to be a little bit hard to separate our teaching effectiveness versus the student preparation for those assignments. So definitely, I strongly encourage you to do formative evaluation, and that can be something as simple as asking a question in class, using an audience response system, asking students to write a 1-minute paper about a topic. Those are informal ones. Of course, quizzes, mini papers, different things. So just so you get a sense of what the students are actually retaining as they're going throughout the course, instead of waiting until the very end to see what they were able to retain. Anyway, all right. My light, for some reason, is going in and out as I talk, so I apologize for that distraction. Okay, so the other thing is that we have talked about needing to understand our learners, our students, the way that they learn best. Are they auditory? Are they kinesthetic? What is going on there? In that, we also need to be able to assess our students using various modalities. So that's where things come in like presentations, papers, group projects, creating a PowerPoint, whatever. The thing I want to caution you against in pre-licensure programs is that, yes, we do want to use those strategies throughout the program. But in the end, the student has to pass the NCLEX, which, even though we've added a few more alternative format type questions, is still predominantly a multiple choice exam. And so if we do not teach our students how to correctly take a multiple choice exam, I think we're doing them a great disservice when they go to take their NCLEX. And they have to have practice with a multiple choice exam at the level of the NCLEX. So that means those questions need to be more in the application analysis level rather than, knowledge, comprehension, that sort of thing. That's just not going to cut it on the NCLEX. So typically most people will recommend at the beginning of the nursing program that maybe you have 25% to maybe 35% knowledge and understanding questions, and have the rest be application level and higher, and then gradually build on that, because that's what the students need to be able to do. I have attached to this week's post a PDF it's a slideshow, I think, that gives you information about enhancing the quality of your multiple choice test questions, so you can take a look at that. The other thing I want to talk about this week is simulation. I love simulation. So simulation can either be done with low fidelity mannequins. They're the ones that don't talk, move, anything like that. The ones that we tend to practice injections on and inserting Foley catheters on. Then you've got the higher fidelity, and you can do a pulse, a blood pressure, check breath sounds. There's some of them that can appear modeled. I mean, they can get way high tech, and they're very exciting to use. Some places do not have access to those type of simulations. And so I am attaching a video where you can show a class a video simulation, and then you can debrief on it afterwards. Now, I'm not saying that that should be the only method of simulation used, but I think it can add to it if you don't have a lot of high fidelity mannequins. So that's a possibility. Some things you consider there. And there's actually quite a lot of them on the web. The one that I've attached is a postpartum hemorrhage one that I thought was kind of interesting. Besides simulation, and if you're doing it hands-on, trying to make it as realistic as possible, the other piece that's critical for effectiveness is debriefing. Some people just zip through that debriefing and off they go, and really that is the reflection time, and true deep learning can take place during debriefing. So I have also attached some information from the NLN about debriefing with simulation. It's really time incredibly well spent, and you just want to make sure that you've accounted for that when you're setting up simulations for your students. So that's just a few thoughts on the different simulation aspects. There's so many more to cover. I'm really looking forward to seeing what you guys think about the assessment and evaluation and everything that was included in your book. And hopefully we'll have some really good discussions this week. See you in the main forum.